The Hendra virus was first discovered in September 1994 in the Brisbane suburb of Hendra, Queensland, Australia. The discovery occurred during an outbreak of severe respiratory disease in horses. The virus was identified after 21 horses and 2 humans became seriously ill. One of the humans, a horse trainer, sadly died from the infection. This virus was initially named equine morbillivirus, but was later renamed Hendra virus, after the suburb where the outbreak occurred. The virus is now known to be primarily transmitted from fruit bats, flying foxes, to horses, and from horses to humans, although human infections are rare. The Hendra virus is a zoonotic pathogen that primarily spreads from fruit bats, also known as flying foxes, to horses, and subsequently from infected horses to humans. Fruit bats are considered the natural reservoir for the Hendra virus. These bats can excrete the virus in their urine, saliva, and feces, which can contaminate the environment, including pastures, water, or feed. When horses come into contact with these contaminated materials, they can become infected with the virus. Humans, in turn, can contract the virus through close contact with bodily fluids such as blood, saliva, or respiratory secretions from an infected horse. This is most common when handling sick or deceased horses, particularly during veterinary care or post-mortem examinations. Despite the potential for serious illness in humans, there is no evidence to suggest that the Hendra virus can be transmitted directly from one person to another. All recorded human infections have been linked to direct exposure to infected horses. Preventive measures are crucial to reducing the risk of infection. These include minimizing contact between horses and areas where bats roost or feed, and using protective equipment when dealing with potentially infected horses. Hendra virus infection manifests differently in humans and horses, but in both species, it can lead to severe and often fatal outcomes. In humans, the initial symptoms of Hendra virus infection are typically flu-like, including fever, headache, muscle pain, sore throat, and cough. As the infection progresses, respiratory symptoms can develop, such as difficulty breathing, coughing, and the accumulation of fluid in the lungs, leading to respiratory distress. The virus can also invade the central nervous system, causing neurological symptoms such as confusion, seizures, and encephalitis, which is an inflammation of the brain. These neurological complications can be particularly severe, potentially leading to coma and death. In horses, Hendra virus infection primarily affects the respiratory system. Infected horses often present with high fever, increased heart rate, nasal discharge, labored breathing, and frothy nasal secretions. As the disease progresses, neurological symptoms may also appear, including weakness, an unsteady gait, muscle twitching, and head tilting. The progression of the disease in horses can be rapid, and the infection frequently results in death. Overall, Hendra virus has a high mortality rate in both humans and horses. Early diagnosis and supportive care are crucial, although there is currently no specific antiviral treatment available for Hendra virus infection. Treatment for Hendra virus infection is largely supportive, as there is no specific antiviral drug or cure available for the virus. When a patient is diagnosed with Hendra virus, the primary approach involves managing symptoms and preventing complications. Hospitalization is often required, especially for those who develop severe respiratory or neurological issues. In such cases, respiratory support, including oxygen therapy or mechanical ventilation, may be necessary to assist with breathing difficulties. Intravenous fluids are administered to maintain hydration and stabilize blood pressure, while medications are used to manage pain, fever, and other symptoms. In some cases, experimental treatments have been considered, especially in high-risk situations or when the infection is severe. For instance, monoclonal antibodies, such as M102.4, have shown some potential in treating Hendra virus, particularly in animal studies, and have been used under compassionate use in humans. However, these treatments are not widely available and remain under investigation. Additionally, the antiviral drug ribavirin has been tested in some instances, but its effectiveness against Hendra virus has not been conclusively proven. Infection control measures are critical in managing Hendra virus cases, particularly to prevent the spread of the virus in healthcare settings. This includes isolating infected individuals, using personal protective equipment, PPE, and following stringent hygiene practices. Given the high mortality rate and the absence of a definitive treatment, preventing exposure to the virus, especially through contact with infected horses, is essential. Protective measures and avoiding risky interactions are currently the best strategies for minimizing the risk of infection.